Hey, this is Nick Angelis making a video for Dr. Angelis's class. He usually regrets having me be a guest star. Actually, he regrets it immediately, so I guess that's why I'm doing it by video instead of showing up. But the question was, why did I leave the hospital to become an entrepreneur, since you guys are studying that? And he said so many good things about this class. You aren't dumb or lazy like those other classes. Just kidding. So I was looking to move back home to Ohio, and at that point there weren't really many jobs unless I joined the big corporations, and I wasn't really feeling that. And also with my own health, I felt that there really wasn't anything in between, either going the complete Western medicine route and trying powerful drugs over and over again, or alternative medicine where it said, oh, try this supplement for 6 months, a year, 2 years, see what happens. That's just somebody late for their flight in the background. So that's why I thought, well, I might as well start my own thing. And of course, it's a question of what constitutes an entrepreneur. Basically, if someone tells you, hey, you can be an entrepreneur, you're probably selling essential oils or it's a pyramid scheme. I don't think that counts. So that was a lot of it. I didn't have a lot of job opportunities at the time, so I decided to create my own. And then the next question was how that fits my personality. I don't really mind risk that much. And a lot of times I didn't really fit in well in very corporate environments where there are a lot of rules. So it made sense to sort of do my own thing. And then this is a little bit off topic, but Dr. Angelis wanted me to explain my favorite teacher. I think actually I took an anthropology class that was really useful in undergrad at Youngstown State, because the professor would talk about some ancient culture and then give us some wisdom about normal life. Like he would say, okay, it's actually the middle class that's the most wasteful, because if you're poor, you buy 1 potato. If you're rich, you buy 1 potato. If you're middle class, you buy 5 pounds of potatoes and 4 pounds of them rot. So I think anthropology in undergrad was one of my favorite classes for that. So, and then another question was, what help did I get from others? So the idea of entrepreneurship is you kind of go out on your own. To be honest, it's pretty stupid if like you have a job where you can just make overtime by working longer, and that's the end of it. Like you don't have to make your own thing. You can just work for the man, and as you work longer hours, you make more money. It's not that hard. On the other hand, though, a lot of times that's not really possible, or maybe you have a dumb job where it really does nothing for humanity. And I know some of my friends, they need a dumb job that makes money and a job that gives them meaning. Often jobs that don't have a meaning in business, finance, sit all day on Zoom calls, those are the ones that pay well, because you're not really changing society. You're just making some company a bit more money for stockholders. So in those cases, in my field, like being a nurse anesthetist, for example, some of my friends are entrepreneurs where they'll do lip fillers and aesthetics and things that don't matter to anyone. And then their day job is saving lives in the ER or something, and doing the anesthesia for life-saving trauma cases. So often you'll find that. So help that I got from others, I did reach out to some friends when I first started. And then I realized, well, that's kind of complicated. And if I fail, it's going to be super awkward for my friends. So I borrowed money from Dr. Angelis. You should too. It's a great way to go. As well as my other brother and my dad. So that was a total of 15 grand. Put some loans on my house. Did some other financing. A lot of the financing I did, honestly, I probably would have been better off just working hours as an anesthetist and making money rather than the effort it took to do the financing. Because I didn't get insurance payments for about 8 months after I started. So I was paying all of my employees through my savings, and I was working part-time as a nurse anesthetist too. So you need to have some sort of way to get money. For example, if you do a tech startup, a lot of times it's just burning money trying to get faster than the other guys to create a product. I don't really recommend that, because you just burn through so much money, and honestly, who really needs your product? If you're just being an entrepreneur to make money and you just have a stupid app or something, that's going to be really hard once you have to work 60, 70, 80, 90, 100 hours a week. So a typical day for me, to answer John's last question, I'm surprised we haven't had any more airline announcements. Sorry, this is just who I am as a person. I'm in Maui, by the way, so apparently this worked out for me, being an entrepreneur and all. A typical day for me, I'll get to the office around between 8:30 and 9. I'll read some emails, maybe answer some questions from some employees. I start seeing patients. I usually see them in 2-hour increments, 9, 11, 1, and 3. On certain days, I'll work longer shifts. I prefer to work 10 to 14 hours. I still work a little bit at hospitals occasionally and other places to keep up my anesthesia skills. and because I like variety. But so I'll take care of patients all day long. Sometimes I'll do payroll, any issues with the employees. It's not a typical place. There's only like 15 or 16 of us. We're very big on not paying to work. You know how you sometimes have to pay childcare or do all these things just to show up on your job. We're extremely flexible to a fault, but that's my style and other people appreciate it. So it's much more laid back. We don't really have an HR. Should probably get one. Usually I just threaten people that, hey, you need to act right or we'll get some sort of virtual HR. And then the other thing is I often field calls from businesses trying to convince me that I need their business to help my business. Typically, if a business finds you and then tries to convince you that you need them, you don't need them. They must be making so much money to have the ability to do Google Ads or to find you. If you find them, then that's a different story. So yeah, I'll do ketamine infusions. Those can be an hour long, 4 hours long, depends if we're treating complex regional pain syndrome or just anxiety, depression. Spravato, which is a pharmaceutical product, but they have to be in our clinic for about 2 hours. TMS, transcranial magnetic stimulation, another method to treat depression that isn't just a boring psychiatric drug that really doesn't work anyways, but just enslaves you for a lifetime of seeing a psychiatrist every couple months for the rest of your life. So as you can see, it also helps to have strong opinions to be an entrepreneur. When things aren't working right, when it's very difficult, then your feelings about, okay, what's wrong with the world and how am I personally going to fix it, while not catering to like the hero complex that a lot of us have in healthcare, where we want to fix the world and take care of everybody. So then I usually finish my day. I might see the last patient at 3, see them until 5. If I've been productive, then I'll leave then. Often I still have charting to do on each patient. As an anesthetist, it's easy. You just chart during the operation and then you're done as soon as you drop them off in the recovery room. But the way I do it, it's more of like a nurse practitioner or a nurse, where sometimes I still have some more charting to do after the fact of what were their vital signs, how did they improve. A lot of what we do does go to insurance, so I have to have very specific things written down so that the insurance company won't find an excuse to not pay us. So yeah, that sort of thing. Anyways, I have to go catch my flight back to the mainland. Hope this answers your questions. Hope you're paying attention. It's probably gonna be a test question about this, honestly. You really should have been paying attention. Like this Dr. Angelis, I'm telling you, you gotta pay attention. Anyways, have a good day, and that's all I got.